Hey, this morning we're going to be talking about peptides. Peptides are a new element that we've added to the Apex armamentarium, if you will. Peptides work a little bit differently than anything else that we've utilized in the past. Hormones, when we take hormones or use hormones, basically they go into the cell, cause the DNA to transcribe certain peptides, and then the peptides are actually the signaling molecules that actually carry out the functions of the hormone. It's possible now for us to get very specific actions by choosing selected peptides and injecting them sub-Q. One of the things about peptides is that, unlike certain supplements where we take them on a daily basis, peptides are taken in a course. So, for example, this particular one, epithalin, is injected every day for 10 days, and then you're basically done. And you might do that again 6 months from now. If somebody's really challenged, we might do it 3 months from now. But they're designed to be sort of courses like this. There are others that can be taken once a week or twice a week, and we'll go into that as we go through different peptides. And you'll have instructions when you get them. But the thing I wanted to cover today is really how to go about injecting them. Okay, so first they come refrigerated. They come in a bottle, and it comes in a refrigerated pack. It'll be delivered to your home, and it's important to get it into the refrigerator as soon as possible. Now, the peptides have been left out in Australia in heat for 30 days and still retain 97% of their bioactivity. But the pharmacy would like to have them refrigerated, and so as soon as you get the package, get it into the refrigerator, okay? So I just pulled this out of the refrigerator, and I'm gonna go ahead and inject it. So what we do is we open up the little container, and inside is a little vial that contains the peptide. And it comes with a little black cap on top that you just pop off, and then it'll expose basically the port where you're going to put the needle to draw the peptide out. So the way I do it is basically you'll need to have an alcohol prep, and the alcohol prep just looks like that. I tend to use this as a place to lay it. I simply do one swipe across the top to sort of sterilize the top. And then the needle comes with two caps. It comes with a cap on the butt end, which is basically where the plunger is, so you remove that. And then it comes with a cap over the needle. And the needle, as you can see, is very, very fine. It's about a 35 gauge needle. You're not going to feel this at all, quite honestly. And then what I do, this is a half cc, this is an insulin syringe, so it's a half cc, and you basically, in this particular, for this particular peptide, I'm going to be injecting, look just to double check, I think it's a half cc, yes, 5 ml, so, or 0.5 ml. So in this particular case, I'm actually going to be injecting the entire thing, because this is 0.5 mLs right here when it's fully loaded. So what I do is pull the plunger down to that point and then pick the vial up, and you want to have it upside down. I put the needle is very fragile, so just gently push it in like that. You don't want to force it in or you'll bend the needle. And then I inject the air into the vial. If you repeatedly pull from the vial, it'll start to have a negative vacuum inside, and so by injecting the air, you kind of neutralize the atmospheric pressure. Now I pull slowly, and you can see the fluid is coming into the syringe, and I'm watching my 0.5 mark right there. I'll spin that, and you can see that when I get there, I'm right at, I have to look here myself to see. I'm right at 0.5, and that's a full column of syringe, and there's no air in it. Now, I flip the vial over and pull the needle out. That way none of the fluid will leak out, and you'll save it. You don't want to waste any of this. So then the next thing that I do is I'm going to inject it subcutaneously. So I just use the alcohol prep to prep the skin, and then I just pinch the skin like that, and you can take the needle and just slide it in. You really don't feel that. And for this particular peptide, which is epithalin, which is a pineal gland peptide, and has many functions in the body, and we'll send you a sheet, those of you taking the peptides, as to what actions the peptide is having. You can see that injected very easily. I just went nice and slow. You don't want to force it. It's a small needle. You don't want to pop that needle out of the skin or do it. So just very slowly put it in. There's no real bleeding. You're not going to need a Band-Aid or anything. And then you're done. Now, when you're done like this, the next important thing is to safely dispose of the needle. And the way I do that, they tell us never to recap needles because you could stick yourself, but it can be quite safe if you just put the cap on the side and just kind of fold the needle into the cap like that, and then recap it. And then you want to get it and dispose it into one of those red sharps disposals. That way it never functions as a biohazard. You don't want to just put it in the trash. Somebody could potentially poke themselves. So that's it. And then this will go back into the refrigerator. And the other thing about peptides is that, unlike certain supplements where we take them on a daily basis, these are basically set up as a course. So this one I'm injecting for 10 days, and then I'll repeat it maybe in 3 months or 6